Hello there, my name is Sharon Millard and I am one of the speech and language therapists at the Michael Palin Centre for Stammering, and I'm here to talk to you today about parent-child interaction therapy. So let me just share my screen. Okay, so hopefully you're all looking at the right thing now. We're going to talk about parent-child interaction therapy, the 2020 version. What I'd like to just say, first of all, is that this work is not just mine. In fact, it is written up by Elaine Kalman and Alison Nicholas in this second edition, but it really represents work which has been going on at the centre over the 3 or 4 decades. And what has happened with Palin parent-child interaction therapy over time is that it has evolved and it has changed as we've learned more about stammering. We've learned more about the factors that are important, and we've also done some research. So it's very much an evolving process. And so the work that I'm talking to you about today represents all of that work by lots of different people. And indeed, lots of these slides are not all mine either. So I don't want to take all the credit for everything. So I haven't quite got my buttons quite right. Anyway, here we go. So the overarching aim of Palin PCI. So what we're trying to do with Palin PCI is to establish the building blocks for children to become confident and competent communicators. Now, that doesn't mean that the stammering is necessarily going to resolve or that it's going to go as part of the therapy. What we recognise is that there will be children who are going to continue to stammer. And so what we believe very strongly within Palin PCI is that we should be supporting parents at this stage to develop a very positive attitude to communication as a whole. And that we want them to be non-judgmental and more accepting about stammering and stuttering in the home, because that will have a knock-on effect on the child. So our aims in therapy are to reduce the impact of the stammering on the child and to reduce the impact of the stammering on the parents. We want them to be less worried about it. We want the child to not be avoiding speaking. We want the child to be participating and do what they want to do, and whether or not they're stammering. We want to see if we are able to enhance the child's fluency through the therapy, and at the very least to reduce the amount of struggle that they are having as they're talking. And we want to increase the parents and the child's knowledge about stammering. And really importantly, we want the parents to gain in confidence so they know how it is that they may support their child. So what we're going to talk about today, or what I'm going to talk about today, are some of the theoretical underpinnings of Palin PCI, the principles that guide our work, the core values that we have, and to think about those in the context of the assessment process that we go through, the therapy that we do, and we'll think a little bit about the evidence that there is for Palin PCI as well. So where did we begin with all this? Well, primarily, we are operating from the understanding of stammering or stuttering. We call it stammering here in the UK, which we seem to be a little alone in, but nevertheless, we call it stammering. So I'm sorry if I fluctuate between those two different terms, stammering and stuttering. But we consider stammering to be multifactorial. We believe, and we are informed by the research, that it has genetic underpinnings, that for some children it's hereditary, and that really it is a neurophysiological condition. And it is those factors that actually explain whether a child starts to stammer. And in that, though, we have language and we have communication. We have the psychological, we have the speech motor, and we have environmental factors which will influence how the stammering emerges, whether it emerges perhaps, how it develops over time, the severity of the stammering, the severity, the degree of impact that it has, and how that fluctuates. So it is an evolving condition, something which changes, something which moves, dynamic, if you like. And how we encapsulate all that is to use this model. So you can see here, now we use this model. This is, I must say, this is not a causal model. We use this model to inform or really to make sense of all that research that is out there and to inform our assessment processes and to inform our therapy. So we have here our little child in the middle, and you can see that this is the child. The child comes into the world with their little package of genetics, their neurological strengths and differences, their temperament, and we think about that's what they've come with. And we have the physiological factors that we know both clinically and from the literature, which seem to influence the stammering and be influenced by the stammering. So if we think about perhaps, if the child's sick, how does that affect the stammering? If we think about the child who is struggling with sleeping, how does that affect the stammering? How does the stammering affect the sleeping, perhaps? So we have these sort of physiological factors. We think about the speech motor aspects. So we're thinking here about, well, what is the stammer? We think about the stammer in here. What does the stammering look like? What is the tension that's associated? Are there phonological delays or disorders that are associated? Is there a motor component to the child's speech, which we need to be aware of and to understand? And again, how does that interact with the stammering and vice versa? If we think about language and communication, so we know that some children who stammer have advanced language skills, some have reduced language skills, some have a mixed match of skills, and some just have language skills that we expect. But again, we also know that for some children, the longer the sentences they use, the more complex the vocabulary they try to use, the more likely they are, if they already stammer, they're more likely to stammer in those contexts. So we know that language and stammering interact. And we also want to think about, okay, well, how does that child's communication style, how does that interact with the stammering itself? So are they a child who likes to talk a lot? Do they like to use long sentences? Have they got a lot to say? Or are they the opposite? Are they tending to avoid communication because of their stammering? Are they saying less because of the stammering, perhaps? So again, this two-way interaction between language, communication, and the stammering itself. In the psychological side of things, we're thinking a bit about the child's temperament, but we're thinking about their reaction to situations. We're thinking about their ability to regulate. We're thinking about how that is influenced, how that might influence the stammering. We're thinking about the child's level of confidence, what it is about their behavior and their emotional responses that will help us to understand their reactions and responses to stammering, because that also helps us to understand the impact that the stammering is having on them on a day-to-day basis, both in terms of their interaction, but also in terms of their well-being. And all of this is happening in the context of the environment. So we can see that this is going on within the child's environment. And for these small children, we are thinking about the environment primarily as the environment at home. But with it, there will also be, of course, that environment where they are going to preschool. So I should have said at the beginning, what we're talking about here with Palin parent-child interaction therapy are children really up to about the age of about 6 and sometimes 7. Okay, so let's think about what are the sort of core values that we work on and we think about when we're working at the Michael Palin Centre. So we believe that both parents play a critical role in therapy. So where at all possible, we include both parents as part of that process. Now, when I say that, we're talking about both parents who are living in the child's home, or if the parents are in separate homes, parents who have some, sort of a regular influence on the child and see the child regularly. But we do believe very strongly, and so we are quite insistent, I suppose, that we have both parents along right from the very beginning. We believe that parents have a lot to add to this process, and we want the parents to begin to see themselves as expert, not just in their child, but in stammering and their child stammering. And so what we do is we begin the process with very much a shared approach, that while we know something about stammering, which they may not feel so knowledgeable about, they will know a lot about their child and their child in a whole host of different situations. So it is combining this knowledge together, which is the most powerful. Typically, if you're working in a medical model, we talk about diagnoses, we talk about things that are impaired, we talk about things which are not so helpful, things that are not good. And what we do is very much work from a positive perspective, focusing on what's going well, what the parent's strengths are, what the child's strengths are, so that we can harness those. What is it that the parents are doing that is already helpful? Because they will be doing things that are helpful. They'll be tuned into the things that they're worried about and they think are not helpful, but they will miss the stuff that's going well. So we'll talk a bit more about that. We believe, and the way in which we work here, is that the therapist's role is to facilitate, to encourage the parents to come up with their own answers and to reinforce what they're doing and to reinforce their ideas, because that will make them stronger and more able to maintain what they've learned, and it will also make them more able and stronger and more confident to be able to support their child over the long term. We work hard at the therapeutic relationship. We believe that to be a really critical underpinning to parents and children having a positive experience of therapy and for the therapy to have the maximum impact. We treat each family individually. So we consider that the factors that are relevant to any given child are unique to them. There will be lots of commonalities, but the combination of those factors is relevant to them. And for some children and for some parents, some shifts, some strategies they may take on in therapy will be more successful than they will for others. And that's our job as a therapist, is to work out what those are likely to be and to change tack if they're not. And we also very strongly believe that therapy must be evidence-based. And we've been trying to work hard to build our evidence base and the foundations on which we can be convinced that this is a helpful approach. So let's think a little bit about assessment. So the aim of the assessment, in the first instance, we want to find out if this child needs some therapy. So we're going to talk a little bit more about each of these things. We then want to try and work out what are the factors that underlie and influence this child's stammering. So we're going to talk a little bit about that process. And then we want to think about, okay, well, what is it that is likely to be useful for this particular child? So you'll see in a moment that within the program itself, there are lots of different options for that. And it's our job to sort of work our way through that. So initially, does the child need some help? Okay, so we're thinking about, firstly, does the child stammer? And that is not necessarily quite as obvious a question as it might sound to begin with, particularly if the child has some language needs or maybe even if they're bilingual. So there is some data to suggest that there are more disfluencies, which may appear like stuttering in bilingual children, but we don't know an awful lot about that. But anyway, primarily, is the child stammering? That's the first question we want to ask. And is the stammer having an impact on the child or the parents? Because if it isn't having an impact and the child is doing some gentle repetitions and isn't too worried about them, isn't doing any struggle, and nobody's worried, the parents aren't worried, then we don't need to be doing therapy, okay? So, assuming that the child's stammering, that the parents are worried, perhaps the child's having a negative reaction to the stammering behaviours, what we want to do is do a full assessment. And the way in which we do this is to do it within 2 different sessions. We're trying to find out what are the child's profile of skills and how these affect the ability to be fluent within the context of the family. In assessment session 1, we make a parent-child interaction video and we go through a child assessment. And I'm going to say a bit more about that. In session 2, we go through a case history with the parents. We then put the information from session 1 and the case history together, make sense of it in the context of the model, and we tell that back to the parents and explain it to them. And we make some recommendations for therapy. Okay, so we're going to talk about session 1 and session 2. So in session 1, the first thing that we're going to do is make a video recording of the parent interacting with the child. We're going to screen the child's speech, language, social communication skills. We're going to do an assessment of the stammering, and we're going to explore the child's perspective. So when we're making our video of parent-child interaction, we do this at the beginning. It's a really nice moment when the child can be settled into the clinic room. We ask the child to find something they'd like to play with their parents. We video the child playing with mum, playing with dad, not necessarily in that order, but playing with each of the parents. And we say to the parents, we're just going to do this little recording. We just want to see what they're like when they're interacting and they're talking with you. But you don't need to make your child talk. It's really just to see, give us a little snippet of them in a different speaking situation. And this often makes sense to parents because often they'll come, and if you haven't done something like this, they'll be saying, oh, well, he's talking to you and this is happening, but that's not what I'm saying. So we're very thoughtful about how we are from this very beginning saying to the parent, you're the expert, you will be seeing something different to us, and we are ready to listen to that, and we're really ready to observe it. And we do approximately 5 minutes of them playing, the child playing with each parent. We will then take a look at their language skills, receptive and expressive language skills, because we want to think about whether those are having an impact on the child's ability to communicate, whether they're influencing the stammering or the fluency. We want to look at phonology and speech signs, whether the level of intelligibility, do they have some word finding difficulties? And we're screening really for whether there are delayed or advanced skills with respect to language, whether there are mismatches, and whether there's any sort of subclinical issues. I expect the same is the same with you. Not all of these children will, reach criteria for referral to speech and language therapy for input for their speech and language skills. But when we take that in the context of the stammering, are their skills adequate for their attempts to communicate? That's really what we're after. So in terms of our assessment of stammering, what we're trying to do is establish the severity. So we're looking at frequency and type of stammering and the behaviours that we're observing. We do a short video recording of them describing a series of pictures, and then we transcribe it. It gives us another opportunity to look at the language skills and the use of language. And we will calculate the percentage stammered syllables and do a description around that. And we would do the SSI-4 to make an estimate of the severity so that we can monitor over time. So throughout the process, what you will find if you have the manual or if you do any of our training is that there is this profile that you're completing as we go through. And so when you have done part of the child assessment, you already have some information that you may add to this. So here we're able to talk about and complete some of what we've noticed around language and communication. So we're noticing if there's anything on this profile which we need to be alerted to, which might inform our recommendations for therapy or even the content of the therapy. We've got some information about speech and motor skills. We've got the information about the stammering itself, and the child's use of rate of speech. And we might have some indications about their temperament, how they're interacting with us, how they interact with strangers. And then what we're going to do is we will be adding to that. So if we think about this summary chart, you can see I've just we've homed into the top section here, which is around assessment. Sorry, I should have said the bit at the bottom is to do with the therapy itself, and we'll home in that on in a moment. So this is to do with the assessment part of it. And then we start to begin to think from here, from the child assessment, and then we'll add to it also from the session 2 where we've met with the parents and gone through the case history. We're thinking about what does the child need. So are there elements of the child assessment where we're thinking, okay, well, maybe this child needs some support with their language development. Maybe this child, we have some sense that this child likes to get things right. They're becoming distressed if they feel as if they've made a mistake or things are not going quite as they had expected them to. So we're starting to think about, okay, what does the child need if we're noticing those from our child assessment? Thinking about the PCI video. So what we're doing is thinking about, don't worry about the A and B at the moment, because we're going to show you that secondly, but we're thinking about what is it that the parents are already doing. So for the moment, this is just about what we're thinking. What is it this child needs? So if we have a child, for instance, who has delayed language, then perhaps what we might hope to see in the video is we'll be thinking, okay, well, I expect this child needs a little bit more time to formulate. What is going to be helpful for this child might be that the parent's language matches something that they're able to understand, for instance. And then we're starting to look for what the parents are already doing that's helpful. What are their instinctive responses? What are they've already tuned into that perhaps they haven't even noticed that they do? And then maybe some ideas of things that would be helpful if they did a little bit more of them. And these are the strategies that typically we're thinking about and that typically come up. So we would be thinking perhaps about whether the parents are following the child's lead. Does the child have enough time to complete what it is that they're trying to say? Are the parents pausing? Is the speed of speech something that the child can tune into? What is the eye contact like between the two of them? What is the level of language input? What is the style of the language, perhaps? What is the balance between the commenting and questions, or anything else that you might be thinking, okay, well, it would be helpful for this child to have, which is A. And then we're noticing about whether the parent is using it and whether it would be helpful for the parent to be doing more of it. In session 2, the parents complete the Palin parent rating scales. I'll tell you about those in a moment. They're going to go through a detailed case history. Then we're going to put all the information together and tell them about what we're thinking and what the therapy recommendations might be. And this session typically lasts between 2 and 3 hours, so it's quite a lot. So the Palin parent rating scales. Now this is a measure which the parents complete. It's online, it's standardized. We've been through the psychometric analysis of it, and it's something which you are very welcome to sign up for and just to use to see if it's helpful. And what it does is it gives you a score for the parent's perception of the impact that the stammering is having on the child, the severity of the stammering, and the impact that it's having on them, so their worry about it now and for the future. It gives you also a score for the parents' knowledge about stammering and their confidence in managing it. So this is the website where you may get it. If you go to the Michael Palin Centre website, again, you'll be able to find it there. And you register as a researcher or as a clinician, and you're given a code, and then you register your clients on there, and then you give the parents a code which is allocated to them, and they go in and they complete it. And all the information just gets sent to your inbox. Okay, so that's the parent rating scale. So if you remember, another part of this session then is the case history taking. And through the case history, this is quite comprehensive. And what we do is we start off by saying to the parents, this is not us trying to find out who's to blame for the stammering. This is very much because stammering is a complex, complicated condition. There will be lots of factors which will be influencing the stammering, and there will be lots of things that are going on that are helpful. And our job is to work out what are the helpful things that we can do more of, and the things that might be making it a little bit trickier for everybody to manage this. So we ask them to describe what they've noticed, the different contexts in which they notice the stammering and any differences those have. We talk about communication. We ask them to describe the child's language and speech and how they're interacting with their peers. We find out about health, development, eating and sleeping, often disrupted for these children and very anxiety provoking for parents. We find out about the child's temperament and their personality, the child's relationships with their peers and other people in their environment. We ask about family history because we know it runs in families, about the family relationships, how the parents work together, how they support each other, how they support the child. We ask about the child's school, how they're getting on in class, if the stammering is having any impact on that. And how the child's behaviour is managed at home. What are the things that trigger the child to become distressed or cross, how they regulate that, how the parents regulate that, how they support the child with boundaries, and whether they are both managing that in the same way or whether they have differences in how their child reacts to that. And really just about the child's, we end up with this sort of, again, about the child's development and whether there are any other conditions or whether there are any other aspects for the child which are going to be important for that child as a whole. So we're thinking very much about the child holistically. So in the formulation, this is where we just put all this information together. And so we will say to the parents, okay, we're going to now think about everything that we've learned about your child from the child's assessment, from what it is that you told me today, and we're going to think about the factors that are important for them. So we will give them a summary of the factors, the physiological factors, the physiological makeup of the child that seems to be relevant for the stammering, talking about the genetics or lack of, talking about how the child's sleeping patterns might be influential, how they behave when they haven't had enough sleep, and whether the child who needs a lot of sleep, so we need to take account of that. We talk about the stammering itself. We talk about whether they seem to be talking very quickly and whether that seems to be relevant. How the language profile looks and how that might be interacting with the child's fluency, and then how that also is all impacting on their communication skills. And we're thinking about the child's temperament as well. We talk to the parents about the relevance of temperament, how that might be affecting their behaviour management decisions, how it might be affecting the child's ability to regulate themselves. And we talk about the things that they are doing already that are really helpful. And this is really important. I keep saying this, I know, but it is really important that they hear their strengths. And then we make some therapy recommendations. Now, for most children who come and see us, we will be recommending Palin parent-child interaction therapy. No great surprise there, but we will be talking about the different components that might be relevant for that particular child. And then we tell them a little bit. It could be that they go into monitoring and review. Or it could be that there is another therapy approach that they would prefer to go through. Maybe they would prefer to do Lidcombe, for instance, or maybe there is an onward referral to be made to another professional. So let's think about the therapy itself. So Palin PCI, we think of this really as a 1-year program. We monitor children and the parents. We keep them with us for a year where we can. They have 6 weeks of sessions. They take place once a week. Both parents and the child attend. The sessions are about an hour long. And then they go away and they have a 6-week consolidation period, and they come back for a review session and they have some more therapy if it's needed. Most children don't, but some will. So PCI focuses on parents' intuitive understanding and develops it in order to facilitate the child's natural fluency. We believe that one change in their interaction triggers changes in others, and that it's a 2-way process. So that when the child makes a change, so do the parents, and when the parents make a change, so do the children. Therapy is collaborative between the parents and the therapist. And as I said, the therapist's role is one of facilitator and reinforcer, and we give feedback that is focused on the strengths that we observe. There are 3 main strands. We have the interaction strategies, family strategies, and child strategies. Now, I'm not going to be able to go through these in any detail whatsoever, but I'm just going to give you an overview of the sorts of strategies that might be included within the programme. If you want to use this programme, you really need to do the training. There's a 2-day training course, and that will give you the knowledge and the skills to be able to adapt this and to use it. Because it looks really complicated, and you're not going to do all of these things with all the children and all the families who come through. You were probably going to pick, and the parents will probably pick, a couple of interaction strategies and a family strategy. And some children will go on to do child strategies, and some children will not. So we're thinking here that the underlying vulnerabilities that predispose a child to stammer make it more difficult for him to be fluent in the context of typical adult-child interactions. We're not saying that the interactions between the parent and child are abnormal or need to be fixed, but we do need to do something differently, perhaps, or shift the balance in the interactions in some way because of the child stammering. Parents of children who stammer are not any different from parents of children who do not stammer in terms of their interaction style. There was a whole body of research, a whole lot of research that went on in the 70s trying to find out if there were differences. And there weren't. Well, some studies found that there were some differences, but actually when they shifted that research paradigm, so Myers and Fosnot were known for doing this, they shifted it round and they looked at how parents of both children who stammer and children who don't stammer interact with children who stammer and children who don't stammer. And they find that all parents did something slightly differently, whether when they're interacting with a child who stammers versus a child who doesn't stammer. So it is the stammering that can make a little bit of an impact here. So changes in interaction style are not the causal element, but they can be influenced by the stammering. We take the view that parents of children who stammer are interacting with their child in ways that support the fluency and the child's communication. Our job is to tease out those ones that are helpful so the parents can do more. The stammering influences the parents' interaction styles, and parents can modify their style, and they find that easier when they're doing more of something that they already do. And that the changes in interaction style can increase the child's fluency. So the interaction strategies that often emerge from the sessions are these: following the child's lead, giving the child time, and so on. And you can see here how they fit onto the model. And how we do this is to set up something called special time at the beginning of the therapy program. And special time is a 5-minute practice time that the parents will do between 3 and 5 times a week. It's their opportunity to try out what they learn in therapy. Parents and therapists discuss what the child needs. So remember, we're already thinking from the assessment process, and they will already have some ideas about what the child needs to help him to be more confident and to communicate. And the parents and therapists watch the video of the interaction. Now, crucially here, we ask the parents to identify what they're already doing to support the child's communication and fluency. They answer the question. So mum comments on her video, dad comments on his video, and we ask them to identify 3 things that they're happy with, 3 things that they notice that they're doing. And we talk about why those strategies are helpful for their child. We ask them to come up with the ideas. And then we agree on one strategy they're going to do more of in special time. And they probably, over the period of the 6 weeks, they might have 2 or maybe 3 interaction strategies that they'll work on. And then for some families, there will be family strategies. So this might be about the 2 languages. We often have a question if a child's bilingual, should I drop one language? Should we focus on one other language? How should we manage that? So we will talk about that. We'd be talking about stammering, being open about stammering, building confidence in the child through praise. Now, I have to say that praise is probably a topic that we do with just about all families that come through, because it is so important. It's a real foundation skill for building the child's identity, for building the child's resilience, and for building the child's confidence. We might be talking about turn taking, dealing with feelings, thinking about those children who are easily aroused, maybe more prone to negative affect, managing with tiredness. I've mentioned that a couple of times already. That's often an issue or something that they need support with. Children who have high standards, who are demanding of themselves, expect things to be correct and in just a particular way. Behaviour management, routines, and pace of life. Sometimes it's just about slowing things down a little bit for a while. So this is a good book. So I mentioned praise very quickly there, but this has a fabulous chapter in that we use with parents about praise. There's also a lovely chapter about managing children's feelings. So we use this a lot to work with parents. They do these, 2 or 3 interaction sessions, maybe a session on praise, maybe a family strategy session, and then they go off and they implement this at home on their own for a consolidation period for about 6 weeks. They continue to do special time, they fill in a homework sheet, they send it back, and we will respond to that and give them feedback. And then we see them again. And in that review session, we're really thinking about how are things going. So we redo the Palin PRS, we have another speech sample analysis, and we think about whether the next steps, is it something that, are you happy to carry on as you are? Are the things that you'd forgotten about that you want to put back in place? Do you need any other sessions which would to help you to do that? Do you want to add to anything you're already doing? And perhaps we will introduce some child strategies. So it becomes more direct, perhaps, at this point. And when we're thinking about child strategies, we're thinking here about, being more open. It might be that there are some strategies that they will use directly in relation to speaking, maybe going a little bit more slowly or increasing their pausing. That might be to do with language. It might be to do with the stammering. But we are maybe involving them now in building their own confidence, talking openly about that, desensitizing around stammering, thinking about thoughts and emotions, really understanding how stammering is different when you're feeling differently, how your behavior is different when you're feeling differently, and so on, and really understanding how these things all knit together. Maybe alongside that, we might have more concise if we think about the children who keep talking and talking and talking and taking up a lot of turn time, but also then the impact that that might be having on their fluency. And maybe they'll need some language therapy or phonology therapy. So again, this might be just a few sessions to top up what the parents have been doing themselves and really getting the child a little bit more involved You're not going to do all of these, maybe one or two. So let me say something about fluency, okay? Do we have a fluency goal? Well, for this age group, a lot of children are going to stop stammering. They're going to stop stammering naturally. For some, that's going to be facilitated by the therapy, we hope, we think. And for other children, they are going to carry on stammering. But remember what we said at the beginning, that fluency is not the primary or the most important outcome of our therapy. What we want is for children to be confident to communicate. We want them to be able to communicate and participate. And we want them to do that whether or not they're stammering. So we might need to do some work with school and nursery, and we might need to get some onward support, perhaps for children, thinking of children who are particularly anxious, perhaps, or if they have learning needs or something else which has emerged as part of the process that you've been through. So let me say something about the research evidence. So we have looked at the efficacy and the effectiveness of Palin PCI. We have 2 papers published which have looked at the efficacy of Palin PCI using single subject study approach. So children who are monitored before therapy, during therapy, and after therapy for a period of time, using repeated measures and using a process of analysis where we have been able to look at differences in trend between those different phases and been able to establish that they are making progress over and above what is a natural variability in their stammering behaviour. And we've also had a longitudinal group study looking at clinical data collected at the centre. And through all of these studies, we've shown that PCI can result in a significant reduction in stammering frequency, and that can be maintained long term. So we've had up to a year of monitoring. We find that there is a reduction in stammering impact on children and in parents, and that parents feel more knowledgeable and confident to support their children when they've been through this process. Interestingly, you might remember there's a lot of research that's been done looking at what are the factors that might be predictive of risk of persistence. We didn't find any evidence looking at the single, because we did these single cases, we were able to profile them in quite a lot of detail. We didn't find that those factors were predictive. So, for instance, if, a female with no family history, you might think, okay, well, that child is more likely to grow out of the stammering. We didn't find that was necessarily predictive of therapy outcome. Stammering frequency and severity didn't seem to be related to outcome either. And what was considered to be successful outcome was not limited to or indeed dependent on stammering frequency. So just to round this all up, Palin PCI focuses on what facilitates a child's fluency, confidence, communicative competence, and is based on their individual needs and their individual context. And it builds the child's skills through parents' insight into what the child needs. The role of the therapist is to elicit this knowledge from the parents, asking them questions, not telling them what to do or modelling it for them. We use video recordings to facilitate and reinforce the parents to do more of what helps, and it empowers parents to support the child. Critically, it empowers parents, and it enables the child to become an effective and confident communicator for the long term, whether or not they continue to stammer, and provides the parents with the skills and the child with the underpinning skills so that they can manage in the long term. So this has been a very rapid run through, rapid a brief insight into Palin parent-child interaction therapy. If you want to use this approach, you really do need to get some training and to listen to hear more about it. But I hope I've given you enough information to sort of whet your appetite. So I need to acknowledge all of our supporters, Whittington Health, Stuttering Foundation and Action for Stammering Children. As I said, all the therapists at the Michael Palin Centre have been involved in the development and the implementation of this programme and in the collection of the data to build our evidence base. And of course, the children and the families are giving us their opinions all the time, and we adapt according to what they need and their input to this. So thank you very much. So if you want to know more, you can find it on the website. Thank you very much. And I